Welcome to the Perspectives on Healthcare podcast, where members of the medical community from different roles, venues, and locations share their unique perspectives on quality healthcare, its future, and how to improve it. Now, from the Your Keynote Speaker studio in Pittsburgh, Pennsylvania, here is your host, Rob Oliver.
Thank you and welcome to Perspectives on Healthcare. This is another of the Patients Interview Marathon. This is Wanda Allen. She's from down in Mississippi. It is number 39 in the series, and I hope that you enjoy my conversation with Wanda.
Hi.
Hi, welcome to the podcast. Let's start off with, what is your name, please?
Wanda Allen.
And Wanda, where are you joining me from?
Today I'm in Oxford, Mississippi.
Oxford, Mississippi. Fantastic. I think, so one of my goals with the podcast, as I've mentioned in a couple of previous episodes, is to have somebody from every single state represented. And Mississippi is not on the list yet, but thankfully we are now able to check that one off. So Wanda, thanks for being here. And let's start right here. Can you tell me a little bit about yourself and your experiences in healthcare, please?
Well, fortunately, I don't have a lot of experience, other than the annual appointments. And I've had 2 surgeries in my life, and they were quite a while ago. They went well. So overall, I've had good experiences overall.
Good. The implication there is that there were some experiences that were lacking, but in general, it's been at least good. Am I reading between the lines too much?
Yeah, no, it's good. There's just a couple things like, why does it take 3 months to get an appointment for your annual, your annual physical? They're so backlogged. It's crazy. So there's a level of frustration, but, I don't know what the answer to that is, but I just know, like, I'm in a place now, I need to schedule my annual several physical dentist. I have a reminder literally for 3 months before, because
Wow.
so I have a chance at getting in when it's due.
It's so difficult when what you're saying is, like, you have to schedule yourself that far in advance where, and I'll admit this, I mentioned it in an earlier interview that, I see a spinal cord doctor because of my disability. And when I see them, I'm getting an appointment that is 6+ months out. And so and that's because she is a specialist and she's extremely good at what she does. And there's a lot of us that rely on her. But thankfully, she is willing that if I really need to get in to see her, she can squeeze me in. But she says to me, listen, you need to have a primary care doctor because I can't be that for you. I can only be your specialist. So, but again, it's that idea that you're looking at having to schedule that far out. It's crazy.
It is crazy.
Yep. So, have you met? See, I've been doing this now for 10 hours, and if I repeat a question, I will apologize for that. Have you met any healthcare heroes along your journey? Or did I just ask you that?
No, you haven't asked me that.
Okay.
You mean in terms of doctors or?
Anybody who is going above and beyond, or anybody who you would say, this is a great example of somebody who is doing it right in the healthcare world?
I
No.
can't think.
That's okay. That is a valid question, or a valid answer to the question. And it's interesting to me because what you're saying is that for the most part, it's been a good experience, but there isn't anyone throughout that experience that stands out to you and says, this is somebody for whom it wasn't just a good experience, but it was a great experience. Am I properly understanding what you're saying?
Yeah, but I just had someone come to mind, but it wasn't for me. My husband had back surgery, and
Okay.
so I've gone to the obviously the surgery and then the after appointments, and his back surgeon is the best doctor I have ever seen. He is direct, to the point, but so kind and has the best bedside manners. I mean, it's such a beautiful mix because people tend to be one or the other. He's so knowledgeable. He's so confident in what he does. I mean, I am just so impressed by him.
Wonderful. And the thing that makes him a healthcare hero, you're, I heard you say like it's his knowledge. Is that what it is that makes him?
His knowledge and his confidence in what he
Okay.
does. He's no nonsense, but yet he's so kind and caring. Caring's probably the better word. He's no nonsense and caring, and that is such a beautiful mix.
Right. Okay. So again, just to reiterate what I'm hearing you say, there's knowledge, there's confidence, and then at the end of it, you're saying he's caring, and that's what makes it a huge difference. Very interesting.
Yes.
So what does quality healthcare mean to you?
Well, being able to get in when you should, when you have insurance and not having these enormous bills coming at you. It's like, wait a minute, I have insurance. Why am I? That's such a frustration. I just never know what I'm going through some issues right now with billing, and it's so frustrating. But yeah, it's just nice to be able to get in when you want to get in, not have to wait forever and a day, and not have surprise bills show up in your mailbox where you're going, what? And then you've got to call, and you talk to two different people from the same company, and they give you two different answers, and it's like, oh my gosh, it's crazy. It's such a circus, it's this runaround, and that's a real irritation for me.
Yeah. So two things that I'm hearing you say. One is access, being able to get in when you want to get in or when you need to get in. And the other is to have some form of organization when it comes to billing, and so that you don't end up with surprise billing, that you don't end up, and maybe you can comment if you've had this experience or not. Have you ever had the thing where it seems like a routine appointment and it gets denied by your insurance company? Has that ever happened to you?
No.
Oh, well, lucky you is what I'll say on that. But yeah, that's sometimes something that happens, that we're headed in the right direction, doing good things, and then all of a sudden, there are circumstances outside of our control that we end up with extra bills, extra things that we weren't counting on. So,
Well, I did have a situation. It's very recently. I'm still dealing with it. I had my mammogram, and that's a wellness check. And I've never, ever had to pay because it's an annual wellness check. And I get a bill for $90, not a lot of money, but why am I getting a bill? Well, one lady tells me because the person that I went for the x-ray wasn't approved by the insurance company. And I said, well, the doctor sent me. And I went down the hallway. It's not like I went to another city. That's crazy. Then nothing ever happened, so I had to call back, and another woman says, oh no, that's not the reason you're being billed. You're being billed because that's the charge to have your x-ray reviewed. I said, what? That's crazy. You see what I mean?
yeah.
It's
Well,
crazy.
I mean, and that's where you end up with the difference between the specialists, where it's, I don't know, it almost feels like that, like somebody is double dipping, right? Because
Yeah.
you get charged for somebody taking the x-ray and you get charged for somebody reading the x-ray. It doesn't make any sense to have an x-ray taken if nobody reads it. So how come it's a double charge there? And you're so correct. I think that one of the difficult things that I see is that doctors aren't necessarily up to date on which insurance covers which things or works with which organizations. And so for your doctor, he says, just go down the hallway, get this taken, and we're good to go. And yet he's not seeing the fact that it's your insurance, and your insurance says you can't go down the hallway. You have to go across town to get there, right? That it's it. We want our hospital, we want our doctors to have all of the medical knowledge, but the crazy thing is that now they need to have insurance knowledge as well. Does that resonate with you?
Oh yeah. In fact, you just reminded me of another situation. So osteoporosis runs in my family for the beginning of time in my mom's side. So I have it, and I had to get an infusion. This just happened probably about 6 months ago. And so I get there, and she said, well, did you bring the medicine? And I said, what? And she said, yeah, you need to pick it up. We called it in. I go, this is this is an injection. This isn't like going to pick up some antibiotics. I said, no one ever told me that. I said, that's like telling a cancer patient, yeah, you're going to get your chemo next week. Oh, and by the way, go pick it up at Walgreens, at your Walgreens pharmacy. I said, that's what that's like, number one. And number two, why didn't anybody tell me? So we had to cancel. I had to reschedule. I had to go pick it up. It was like $120. That was a surprise. It's like, who's on first here? And then I felt bad because I know with Corona, with the COVID and the healthcare workers they're in such overload and they're understaffed. So, I didn't want to go too hard on them. And it's just like, it was crazy. But, I drove 35 minutes from where I live, and I had to drive all the way back. And yeah, it's like the communication or who knows what about the situation, and why aren't they guiding me?
Yeah. And I think that's the crazy part. You're talking about communication, and it's the right hand doesn't know what the left hand's doing. And
Exactly.
the patient doesn't know what the provider's doing, and the provider's not telling the patient what they're doing. And you end up with this kind of disconcerting disconnect where, is that too many disses or anything right in a row? But you end up with a disconnect where you're feeling left out. And it's a waste of your time making you travel across town to get to the thing and to find out that you didn't have what you needed because, and in that, did anybody apologize to you for that, or was it just kind of a statement of fact?
No, they said, I don't know why you weren't informed. And the thing is, this wasn't my first time of ever getting this injection. This was like my third time. So I said, actually, it's my fourth time. And I've never, ever had to do that. And no, it's like, well, I don't know why. I'm sorry. I don't know why. No, you weren't told that. That was it, which really make me feel a whole lot better. But I was so frustrated.
Right.
It was, to me, it was just a crazy way to do business. To have your patient go get that, get that medicine. That made no sense to me.
Right.
But whatever, I had to do it.
Yeah. And that's just it. Sometimes you have no choice. And it's, like your time doesn't matter. And your time has no cost. It's just a matter of, it is what it is. And of course you're going to reschedule, and you're going to go and you're going to pick it up, and you're going to come back, and the whole thing. It's so difficult and so unfortunate. And I'm sorry for your frustration.
Yeah. And I don't know if it's just the whole COVID thing and they're just strapped so thin. Cause I just had another situation where I got a $325 bill. I said, what is this for? And, oh, it's your mammogram. Well, yet again, I've never had to pay. Well, you know what it was? The doctor didn't authorize it. And so the insurance gets it and says, well, this wasn't authorized. And I said, well, of course she authorized it. I would have never got it. So I've never, this has all happened within the last 12 months. Is it because of COVID and they're just strapped so thin? They don't know, which side is up. I don't know, but it's really been an unusual experience. And I told the lady, I said, I'm 58 years old. This is not my first mammogram. There is no way I'm going to go get one on my own without doctor approval. I've been around the block a few times. So,
Sure. But,
I don't know.
You're not old enough to have been around the block that many times. So, but it's not your, so to speak, it's not your first rodeo. It's not the first time, but yeah, so sad, so difficult. And I appreciate your willingness to share those experiences. What is one thing that medical professionals can start doing today to improve the quality of healthcare?
I think if they can figure out how to not have such a backed up schedule, because how can you serve really well if your patient, I go to urgent care because I know it's going to be 2 months before I can see my GP. So that's it. I don't know who can fix that problem. Or, I don't even know why it is a problem, but to me that would be huge.
Okay, so what I'm hearing you talk about is that it's a systemic issue. It's not necessarily the people. Sometimes the people are not the most polite, and they seem kind of, maybe cold isn't the word, but they're matter of fact, right? So the person that was talking to you about not picking up the the infusion, that like, okay, you didn't get it, don't know why. Oops, sorry. Now go do it. Most of the time, though, the problem is the system. It's not the people. What's your reaction to that idea?
Yeah, I do believe it's more system issues, because to me it's a universal problem. It's not just one doctor's office. It seems like if I'm in California and it's the same issue. I'm in Mississippi, it's the same issue. So it's a universal systems problem, as I see it.
Sure, it makes perfect sense, and it makes perfect sense to me. And I'm just sad that we can't make the system make perfect sense for everyone else and move forward from there. So, listen, Wanda, I appreciate you being here. My next guest is not here, but my guest after that is already here. So I'm going to let her jump the line and join me immediately. So Wanda, let me just say, I appreciate you being here. I appreciate you sharing your story, your thoughts, and I respect your perspective on healthcare.
Well, thank you so much. Best of luck to you in this. Take care.
Right. Take
Bye-bye.
care. You too. Bye-bye.
Thanks for listening to Perspectives on Healthcare. Visit perspectivesonhealthcare.com to learn more about Rob Oliver or to subscribe so you never miss an episode. If this podcast was valuable, we'd appreciate a review on iTunes. Or if you tell a friend or coworker about the show, that would be helpful too. Join us again next time for more Perspectives on Healthcare.